handbook where that is. So I'm going to drop the section of the handbook where that is during the meeting so we can just take our time. It's just talking about your podcast, just like the same thing you did when you were applying, but now in a video format. So that's just the announcement so that we can kick off, start putting together every information piece we need. But aside that, I think I'll pass it on to Candace while we wait for the folks to join.
All right. Thank you so much, Sabat. So thank you for being here, Dahlia, Dr. P, Josephina. Excited. And then obviously for those of you who will end up watching the recording, I did want to mention though, I know things definitely come up in people's lives, and thank you for always letting us know. But we do want to absolutely stress the importance of completing all of the curriculum for the Thought Fellowship. Remember that you guys have a trial period. So before you officially are able to create a multiple podcast with BCPH, there will be certain criteria that we judge you by. So absolutely, if you do miss a session because of an emergency, let us know, and then absolutely complete what you haven't done, and write us too as well. So once you've rewatched something that you may have missed, write Sabath, myself, and Dr. Cersei some key insights that you got from that. People do tend to get very behind if they do miss a session. So it's very important that people, show us that they're catching up, because we do use that in terms of determining who will move on to the final round. Okay, so as I said, we understand emergencies do come up, but make sure that you catch up, and so that we can feel strongly and moving you to the next phase. Any questions from that?
Yes, I
Yes.
wanted to clarify. I think initially we had a calendar invite for tomorrow, but I don't see it anymore. Are we still meeting tomorrow as well for the continuation of the session?
Yes, we are. I saw the same
Okay.
thing, Sabat, that something that initially the invites were sent and then they were canceled on my calendar.
I think that probably was an error. I noticed it today. That's why I resent the invite. But I think it was, I don't know, from Google, or but it was an error. So we have today's session and we have tomorrow's session just to chat about reward experiences. So sorry about that.
That could be, if
Thank you.
Abiola's not here, he may have seen that and then made that assumption that we were not meeting. So you
Mm.
may want to write to him directly.
Okay.
Okay. All right. So I'm excited to get started. I will say that the PowerPoint that I'm using is interesting. So when I shared it earlier, it'll make it so that it's very hard for me to see the Zoom. Please definitely feel free to shout so I can, because it's one of those things, I'm going to be operating blindly. So I'm just going to be talking into the ether. So unless you speak up, I will not see the chat or be able to see people's faces just based on like what I'll be using. Otherwise, we will get started.
Release the
Okay.
cats in response to that, Candace.
What's that?
I released the cats,
Release the
the
cats.
cat emojis.
Yeah, so I imagine Cersei and Sabath will be fielding any questions that go into the chat. Otherwise, yes, I will not be able to see you, but we'll have plenty of activities throughout. So today, Module 2, Podcasting Fundamentals. And so one of the things I'll say about the BCPH Thought Fellowship is that the way that we focus on podcasting, it won't just be, the nuts and bolts of actually like how do you create the actual podcast, like what medium do you use, et cetera, which Dr. Cersei will go over in her subsequent lectures. But we also talk about how to do it in the most thoughtful and meaningful way. Because there are different ways that people podcast. Some people just grab a camera and they just start speaking, right? Because we are more of an academic institution, we make sure that we want to do it in a way that's more formalized, evidence-based, as we've said before, as Dr. Quinn was talking about as well. So hence why we talk about the operations and the strategy behind how do you create your podcast. And oftentimes, if you study some of the great podcasters, they usually have a lot of strategy. They usually very much plan each and every one of their podcasts in a very sophisticated way. They don't just necessarily call someone up or send an email and say, "Hey, would you be on my podcast?" They usually do a lot more in-depth research about that. And so because of that, that's why we go into these nuts and bolts. So I'll say that for some of you, The things that we talk about today may say, no, this sounds pretty obvious of what you would do. And for other people, it may not be. So hence why we cover it, right? So some of you may have a very different opinion about some of the things that we talk about in terms of the strategy and operations. But just know that we have done this so many times to know that there are definitely people who will benefit from it, and there's nothing wrong with having a refresher. So I'll say that to begin with. If you're like, this is too ABC, hence why it is fundamentals. So ready, set, podcast. All right. So the first thing is that we're talking about today is like, what's the biggest challenge within public health, right? And there's a lot of different things, especially going on within the US, right? Rising drug prices, healthcare burnout, gun violence, everything related to obesity and like the GLP treatments. Are they good? Are they not? Things related to the federal government, a lot of, public health infrastructure being dismantled or completely obliterated. So lots of different things are happening, right? So lots of different things that you can tune into. But one of the reasons we started the BCPH Stop Fellowship is because we wanted to be able to make it so that people could have more evidence-based, rich conversations about these public health topics. Because if you notice, most of the time when you go on to Apple or Spotify, there may not be a plethora of options to be able to get that public health news. There may be a few things. I know John Hopkins has a podcast, and there might be a few other ones, but there really aren't as many. And so for the most part, public health news is but a snippet that doesn't really go into the depth that these topics actually truly necessitate, in our opinion. So I wanted to make sure that we got a chance to be able to talk about, and go ahead and stop sharing here. All right. Talk about what is it that we think are the biggest public health issues. But I'm going to break people. I'll put the three of you in a room since we're not a group of five, and just chat amongst yourselves. Now, obviously, you can talk about the issues that you want to talk about in your podcast, but anything else as well, just to kind of get the juices flowing about what are the things that you care about the most deeply. And it can be about your podcast, but it can be otherwise. So I will go ahead and open up the rooms. All right. And so feel free, Dahlia, Dr. P, Josephina, and I'll give you guys about 7 minutes or so to have that discussion. So biggest public health topics of the day. All right. So I would love to hear from people, some of your discussions. And it's always interesting if people say, this is what I thought, but sometimes it's even better to say, my colleague thinks this is the most important thing, right? Because it shows like how collaborative you are. So anyone who'd like to volunteer.
I don't mind. It's Paola. Oh, no,
Yeah.
Dahlia, you actually raised your hand. You go for it, girl.
I'm so sorry.
It
Well, I
don't
will
apologize.
say, Abiola did bring up his thesis project, which was talking about like provider burnout and whatnot. And then we had a very fruitful discussion towards the end of our conversation, talking about how like that is very much interconnected with our patient mental health as well, and then as well as physician or provider mental health and how that's so interconnected and how that can lead to negative or positive healthcare outcomes in general. So I found that that one was a huge one.
Wonderful, love it. Something I'm also, very passionate about as well. But I think about, like the multiplicative effect, right? So you've got a burned out healthcare provider, you've got a burned out, jaded patient, and when they come together, yes, it may not always be a wonderful thing. Thank you so much. Dr. P, you wanted to go?
I was gonna actually say similar thing to Dahlia, how we sort of, I think the biggest highlight I would say is that all of our projects are actually pretty interconnected, or our topics of interest for the podcast. Even though I'm focusing more on diabetes and chronic diseases, and Josephine is focusing on the mental health, and Abiola's focusing on the burnout. All of that is connected, and Dahlia, I think yours is focused on access or lack thereof. And so all of this is super interconnected, and we sort of like, oh my gosh, we could probably be on each other's podcast eventually, and just talk about the interconnectedness of all of that. And I found that to be very beautiful.
Mhm. Yeah, no, we absolutely encourage that. So if you find that's a unique way to expand your podcast and you're like, you know what, I'm going to invite like every single fellow to be on, for sure. There are no rules against that. Thank you so much. Yeah, Josephina.
Yeah, I really enjoyed our discussion, and something that Dahlia was highlighting was just how the healthcare system is really focused on, or the kind of incentives that seem to be prioritized in the healthcare system, primarily profits over prevention. And I think that's another way that our different topics are interconnected. Um, and I thought that was interesting. Like that really affects the provider perspective that Dahlia is looking at, and then also medication access that Dr. P is kind of exploring, as well as the provider burnout, and then also lack of kind of preventive mental health care services that affect youth mental health that I'm exploring. So I think, yeah, the overall healthcare system and the priorities kind of shape all of our topics.
Absolutely. Thank you so much for that. Abiola, do you feel like sharing?
Yes. First of all, I want to apologize for joining late. Had certain things that happened that I didn't foresee before time. So I'm so sorry. And again, my video may not be on because the computer I'm using doesn't have a web camera. So what happened? I need my phone to be able to access my school email because that's where my conversation with BCPH happens. So I need my phone for a multi-factor authentication. But happened that I ordered a new phone which hasn't arrived, and I already gave out my other phone. So I thought it would arrive early. So I can't access my laptop. So I had to drive down to school to use the school desktop so I can access this meeting. So it turns out that the desktop I chose does not have a webcam. So I'm still trying to figure out things here while I'm listening to what is happening. So I apologize for all of that.
No problem. You know what, Abiola, I can think of a couple situations where I've had to like do jump some hoops just to get some.
Exactly.
So,
Yeah.
So I had to just rush down to school so I can use the laptop, and I won't have to use a multi-factor authentication to access since it's a school laptop. So I joined them while they were talking about mental health and then the task given to them, and I was able to put in one or two words too to what was happening. And like Paula rightly said, all of our conversations are interconnected, and I really love that. So, and you also said what was on my mind, that we can bring some of us to as guests on our different podcasts, which I am going to do. So I wouldn't want anybody to steal that idea. So I'm the first person to mention that. Thank you so much.
absolutely. Yeah, no, exactly. And just as you said, I think in a few um, other sessions, Abiola, like when you said take it to the streets, like if you're wanting to be interesting that way, like where you have a part of your podcast that is filmed on the street, like as you're talking to people, and then you kind of merge that with when you're talking to someone in the studio, so to speak, definitely welcome that because those can always be very interesting as well. So I wanted to make sure that we had, that nice icebreaker, obviously, to get you thinking about like your own podcast and your own thought leadership as well, right? I know we had a great conversation with Dr. Quinn about what it means to be a thought leader. I think there were some questions around, can I invite other thought leaders? Which the answer is absolutely yes. It doesn't mean that you only embody the thought leadership. But the other thing I wanted to do and go off script a little bit is as we're thinking about our thought leadership, what kind of thought leader we're thinking of being, right? And how do we know we're being a thought leader? Do we for all of you, do you know like when you're being a thought leader? Do you feel like someone has to tell you? I'd love to just kind of go around and see people's reflections. So do you know, do you know if you're a thought leader already? And how do you know? I'll put that in the chat too. So
I'll say that sometimes I feel like I hear it from others and it's never, hey, you're a thought leader, you should talk more about this. It's more subtle than that. It's in the way that someone might say, I didn't think about it that way. You should bring it up to so and so supervisor or whatever. Um, it's usually because I tend to think out loud a lot of like, why is this happening this way? Why can't we do it XYZ way? Or if they remove this, then I think that would be easier. So I'm usually kind of just throwing things out loud, and people will kind of just comment on like, well, I don't think they know that, or I don't, I don't think anyone's thinking about it in that capacity. So I feel like that kind of helps me know when. And then on my own, I think when I'm talking to patients, oftentimes I feel like I may get into certain topics of access and trying to help them understand the bigger picture as well, because they're experiencing it and living it, and there's an emotion attached, so it's very personal, right? But I don't think that a lot of our patients understand what's happening. What happened? What are the 15 things that happened before it even reached you that you couldn't pick this up at the pharmacy, or that whatever the issue is. So I feel like in those moments, perhaps maybe to my patient, to that audience, I may appear to be, or maybe speaking in thought leadership ways just to help them become more aware.
Wonderful reflections. Thank you. Like very like multi-layered.
Oh, thank you.
I know for me, if my brain just automatically is wired where if a problem has come to me, whether someone is venting about something, and whether for better or for worse, I always want to problem solve. And so I am that person that's like, oh, why don't we try to troubleshoot and do it this way instead? And so I feel like in that regard, I am kind of a thought leader. And also just being a medical student, I feel like with issues surrounding healthcare system and healthcare in general, um, a lot of people are quick to ask me like what's your opinion as a medical student, and I am quick to give my opinions on things in the way that like I would run things if I had the power. So also in that regard I would say that, and then I will kind of echo what Dr. P said in terms of um when I know I am doing such a thing where I'm not even realizing like maybe I am being a thought leader is usually when someone is like, whoa, I didn't know that. Because I am also like I like fun facts. And so when I learn something, even if someone didn't ask, I'm quick to tell them, like, oh my God, I just read this article on blah, blah, blah. And then they're like, whoa, like, I didn't know this. And then that usually like sparks another conversation. And then I learn things from other people as well. So I will say, like, yeah, it's usually other people reflecting back to me, like, whoa, I'm learning some things, or I never thought about things that way.
Awesome. Awesome reflections. Other
Okay,
thoughts?
let me comment. So I will say I am a thought leader, and like I said last week to Dr. Quinn, that I am a challenger. So I am pessimistic from the optimistic point of view, in the way that I try to defy popular demand.
Mhm.
I don't, if everybody is facing this direction, why is nobody facing here? I want to be the odd one out. If you prefer a solution, I want to be like, okay, what if it doesn't work out? What if
Mhm.
this doesn't work out? Then that gives me an optimistic point of view that, okay, we can actually find a different way to really solve the problem without even going this way. So with that, we can have like five other ways. But because there's nobody asking certain questions, what if this doesn't work out as planned? What if this happened? What if that happened? Because there's nobody asking that, then we are caged, and then we have that we become myopic, thinking it's just one way traffic, whereas there are other ways to solve it. And I figure because of that, I started writing for Canadian Occupational Safety. It's an online media publication, so I write opinion pieces for them. And because I am new in this field, and then I ask many questions, so I see a lot of professionals entering my DM on LinkedIn. When they publish the article on the website, my LinkedIn, it's direct people straight to my LinkedIn. So people come into my LinkedIn to ask many questions, and I'm really happy that those who are already 30, 50 years, in that profession, they come to ask me some questions too, even though I don't have answers to it, but I've been able to, awaken their mind to think differently too. So I see myself as that. So like what Dr. Queen said last week, I mean, she said it was really profound for me, that you can be a challenger. And when I look at myself, I realize that I'm like that. I just want something different. I don't want to do popular demand. I don't want to do what because everybody is doing it doesn't make it right. Even if it's right, I think there should be another way to also make it right. So that's what makes me think I'm a thought leader.
Hmm. Yeah, absolute contrarian. I will say that I share that to some extent, and I will say not everybody understands that thinking, Abiola, because if you're that person who's always pushing against the grain, yeah, it can cause friction, but it can be delightful, right? So I 100% agree on your perspective of what makes a thought leader. Awesome.
Yeah, I really like everyone's perspectives on this. It's really interesting. I think one space that I look at is in kind of an academic space. So, like, I like to kind of keep up with the literature about certain topics, and if there's gaps in the literature or um, topics that aren't being researched and published about, that's kind of an indication of thought leadership if it's an area that I'm actively kind of working in. And then I also like to look at other communications kind of outside of that, like white papers or policy briefs and other areas that um, academia might take a little bit of time to catch up on and see where there's gaps in those spaces as well. And I also think sometimes receiving a little bit of pushback in some areas can be an indication of thought leadership, like maybe for a grant or project, if I'm trying to think of an example, like there was a grant I was working on where it was really important to me that we included a certain area of the community and population to serve on the project, and expanded kind of the languages that we're serving for this particular uh, chronic condition that we're looking at. And there was like a little bit of pushback because it wasn't in like the official kind of grant um, uh, kind of request. So I think sometimes, yeah, trying to reframe how we're even thinking about a topic or asking questions that aren't in the official agenda can be an indication. And then I always also like to kind of ground whatever I'm thinking about or working on with the communities and people I'm serving. So I think conversations with like patients and communities and talking with them about maybe an idea, and having someone say that like it really resonates with them and it's not a resource or something that's really talked about already. Um, yeah, as an important kind of foundation for me in thinking about like thought leadership and innovation and how to generate new ideas.
Yeah, absolutely. So in everyone's reflections, for sure, a lot of similar things echoed. And so slightly different sides of the coin, right? So Josephina, when you're saying like gaps in the literature, very similar, right, to what other people are saying in terms of that's a fun fact. I never heard that before. No one's taken that perspective. Completely agree. The different ways that you can see like thought leadership happening. And yes, most people don't even use the term thought leader, right? In real life, I'm sure no one's probably ever said to you, "You're such a thought leader," but I can confidently say to all of you, like, yes, like absolutely from, this conversation alone. And so I want to continue to encourage you to continue to be that brave thought leader, however you decide to be, right? If you're going to be a challenger like Abiola, if you're going to be kind of like the deeper researcher like Josephina, or you're going to be more like politically charged, maybe like Dahlia, or then more like patient fluent like Dr. P. But whatever way that you choose, I think it will make, for a very interesting podcast. And I think people love to hear, from people who are like setting the agenda, right? There's plenty of Me Too podcasters, right? People who are saying the same thing that everyone else says. They just say it louder. They say it more crass, or, different ways. But yeah, we want to make it so that, all of you are saying things where people are like, I've never thought about that before. One, because people aren't thinking about public health enough. That's number one. And number two, right, that they're maybe taking the 2 minutes they see on whatever news channel that they watch and like, boom, that's their opinion. That's the Kool-Aid that they've drank, about that particular topic, whatever it be, right? Diabetes, obesity, immigration, mental health, right? Physician burnout, etc. All right, so let me go back and hop back into our PowerPoint here. Okay, so excellent discussion. So we'll keep going. All right, so remember, I'm piggybacking off of what Dr. Quinn mentioned, right? So thinking about your thought leadership, are you more inspirational? Are you more contrarian, right? Like as Abiola was saying, right? Are you doing a significant amount of new educational content? So Dahlia, I think you're speaking about that, right? The fun facts that people don't know. Are you exploring industry trends? Industry research? Are you doing a lot more opinion and commentary? So I think this is, Josephina and Dr. P, right? Like, are you bringing in different patient perspectives or community perspectives, right? So think of it that way, right? When you're designing your podcast, what does it look like on this whole continuum, right? Of like education and inspiration, exploration to different types of commentary. And you can push thought leadership in so many different ways, right? So just being very mindful of that. And most people, as I said, right, they just get a microphone and they start speaking, and they never really deconstruct exactly how their podcast is and exactly what they're doing. But with all of you, we want you to, from the very beginning, think about, am I educational and inspirational? Am I, focused on like that unheard perspective from patient voices and community voices, et cetera? Am I a blend of those things? And how do I really push my thought leadership? And then also, how credible am I? And what kind of audience can I really be able to hold, right? Because different audiences may be interested in inspirational content versus those that really are craving those opinions and that commentary from people that you may not necessarily initially think of as someone who has something to say about the conversation. So obviously just continue to expand on that, right? So counter narrative opinions, I think a number of you have touched on that, right? So if everybody says, you know what, and I'm going to go back, probably a decade or more and say, in terms of the contrarian counter narrative, right? And I'll choose a funny example of everyone loved Harry Potter. So no offense to Harry Potter fans out there, but I was definitely very contrarian when it came to the Harry Potter series. And so in that case, I had the counter narrative, right? So maybe we shouldn't all be aspiring to ride broomsticks and fight witches and goblins, right? So simple example of counter narrative. But then also, right, you might be using data about diabetes in certain types of populations or disabilities within different clinical communities, right? Or you might be focusing on the different connections in the various networks as well. So many different approaches that you guys can take with your podcast. So as I said, you can utilize each other. It's very different, right? So for Abiola, if you're interviewing your colleagues and you're saying, I'm going to do a podcast where I'm focusing on a medical student's perspective on occupational hazards of medicine, right? Versus someone who's a pharmacist, versus someone, who's in mental health care, et cetera, right? So lots of different ways you can think about each of your podcasts and the ultimate goals that they will have for yourself, but then also for your audience as well. So I think Dr. Quinn used the strategy framework last time as well. So there's lots of different things I'm giving you guys. So don't feel stressed and say, wait, you just talked about, data driven strategy and counter narratives. I'm giving you a lot of different ideas, right? So ultimately, when you decide which ones you want, and I'm hoping that you have anywhere from 2 to 5 different things that you utilize for your podcast, that you definitely feel confident in which direction you want to go, right? But there are podcasts that lead from that subject matter expertise. So Dr. P, you could just say, you know what? I'm a pharmacist who treats diabetic patients or chronic care patients, right? And you could completely go from that perspective, and all of your podcastees could have subject matter expertise. So you could go by that. Or you could follow theoretical frameworks. You could invite people, that have different perspectives on. I don't know any particular frameworks on diabetes necessarily, but I could think of in terms of if you're talking about disabilities or neurodivergence for anyone any of you guys. There are different types of theoretical frameworks if you're talking about, say, the medical model of disabilities versus you're talking about a functional analysis, et cetera. So you could go from that. And Josephina, you may find yourself doing this a little bit more since you do tend to sound more like you're research driven. And then ultimately, thinking about what is your unique voice? Are you the contrarian? Are you inspirational? Are you building authority? Thinking about all of those, right, as you figure out what you want to do with your podcast. So why podcasting? So we mentioned before that before the last cohort, we'd always had blogs and vlogs predominantly by many of our fellows, and we didn't have as many podcasts. And then we definitely switched the last cohort to make sure that our fellowship was focused on that. So from the BCPH's perspective, why podcasting? We saw it as an even better medium and more rich medium to do public health thought leadership because yes, people still do read blogs and watch vlogs, but we felt that there was definitely a lot of, as they call, white space for there to be podcasting in public health, for there to be more voices to be added to the conversation. So that was from our perspective, why podcasting for all of you. But then I want all of you to reflect on why am I doing podcasting? Why do I want to do this? Why not write a white paper? Why not just do a blog? Why am I doing this? Why am I taking so much time, out of my day, out of my weeks to focus on this particular medium to get my my thoughts across? So one, obviously, is like it's a great way to add education, right? Millions of people listen to podcasts. Some people are more auditory based and they are written based. And so you can potentially reach different kinds of people and more people if you're doing a podcast, especially if you're just, if you have one that's blended, right? Where you have the video portion that people can see, and then you also have the audio portion. So you can get those people who want to have visual experiences as well as those who just want to listen auditorily. You can also build community and authority. So all of you have a certain level of authority where you work or where you may volunteer right now, but being a podcaster significantly can enhance that. And I will say even greater than, even if you don't do 100 podcasts, right, with BCPH, even doing 3 to 5 podcasts can significantly catapult you and change your trajectory, right? In terms of who you are and how many people come to you. And it already sounds like many people are already coming to all of you as experts. And so this even amplifies it even more for you. All right. So the next thing I wanted to do, right, because the aim of the lecture is to continue to think very deeply about who we are as podcasters is something called the podcast value proposition. And so because I'm business oriented and went to business school and I've, taught many MBA students myself, I like to bring in a lot of things from the business world into the things that we do at BCPH. So in the value proposition, and I'll give all of you guys a link to be able to fill this out, you basically can decide on who is your target audience. What is the need or opportunity or opportunities that you're seeking to fill with your podcast? What category is it? Is it inspirational? Is it political? Is it a mix of things? Who can likely benefit from this? Is it just patients? Is it policymakers? Is it other researchers? Is it students, etc.? And then you get to differentiate yourself. Who are you most unlike, right? So you may not have thought about this before, but as you're creating your podcast, you should know what are other podcasters that look just like me and who are those that are very different from me, but they may occupy the same space. Okay, so it allows you to have an even better sense of who you are as a podcaster when you can really clearly define who else that you're juxtaposed to and who you differentiate yourself from. And then ultimately, like a final statement of my podcast is, and how do you truly differentiate yourself? Let me go ahead and stop share there. So one second. You're on mute.
Yes. Do you want me to share my screen or I can just read it out?
You can read it out. That's fine.
Okay. All right. So start with 4. my podcast is for occupational health and safety professionals, public health practitioners, workplace leaders, policymakers, and workers who want to create safer, more human centered workplaces. Then for WU, the organizations and workers, they need a more comprehensive, human centered approach to safety that systematically assesses and protects health, not just equipment. Because we realize that organization, they take more care, they take care of their equipment more than the workers. So that's what it's targeting. Then my podcast is industry analysis. It is inspirational, educational, public health, and occupational safety podcast, which is focused on human centered workplace well being. And under the DAT, it highlights the risks of ignoring worker health and provides practical strategies to assess and improve human well being in the workplace. And unlike the traditional workplace safety programs that focus mainly on equipment and compliance. So, my podcast emphasizes a human centered approach by treating worker health, capacity, and well being as measurable and essential components of safety.
Mhm. Awesome. So I had a couple questions for you. So you're very high level, and so I'm curious, right? As someone interested in this potential podcast, is like, are all industries going to be fair game for you, or are you thinking very specifically about um, companies like Amazon, Tesla, UPS, Boeing. And when it comes to human centeredness, are you thinking about psychological safety? So I'm very curious because you could go in so many directions with this. Because just saying machines, that could mean a lot. And then, like I said, if you wanted to have other people, your colleagues here on your podcast, obviously some people are within healthcare. So like, would they be talking about machines within a hospital or a clinical environment, as opposed to, you know, uh, the people themselves? Now, I can just quickly say within a hospital environment, the machines aren't treated very well either. Unfortunately, they may be treated a little bit better, but there are many issues with things being broken, obsolescent, and all sorts of things. But I digress. But I'd love to hear your answers.
So, you ask about 5 questions. So, can we take it one
Great.
after the other?
Well, maybe it's just food for thought. Maybe there's maybe one thing you wanted to respond to. Sorry.
Okay, so I don't want to, while it is good to streamline everything, but
Mm,
I think that may not help. Of course, you can correct me if I'm wrong. If I'm focusing on healthcare workers, that means somebody who is working in construction may feel like I'm not sure this content is for me. So I'm looking at how I can
mm,
cover all the industries and put them, in one program. So I am also, whatever I'm dealing with at a particular episode will determine who I'm bringing in. And from my knowledge in journalism, when we want to do analysis on a particular subject matter, we bring people from both sides. We don't just bring one person. So if I'm
mm,
talking about how workers are treated, so I'm not just bringing in workers to come talk. I also need to bring somebody in the leadership, in a leadership position to also, share their own perspective why workers are treated this way. And there's a worker too, and there can be a professional who can be like the middleman to analyze what the worker is saying, what the leader is saying, and give us a better perspective. So that brings me to the last question you asked about my colleagues. I know I can use their expertise since they already have experience in the hospital, in the pharmaceutical. So I can bring them in, when I have conversations around healthcare and all of that. I don't know if I'm able to answer some of the questions.
Yeah, no, I don't want to take so much time. I'm just very curious about yours. No, I'm never going to be the person to say like what is necessarily right or wrong. I don't like to take that opinion. It is curious, and I think your approach can work. I do wonder though, just as you said, right? Like if someone tunes into your podcast, will anyone at any point feel alienated and say, this isn't for me? If it's sometimes maybe it is a construction worker who says it's not for me. Maybe it's, if I tune in, I'm like, well, is this meant for healthcare? So I do think you have an interesting challenge. But like I said, I don't know the answer, but it is something that is circulating. And yes, it sounds like you're being very mindful. Go ahead, Cersei. Yeah.
I was just thinking sometimes those are the most worthwhile conversations to have where you're taking a risk on perhaps alienating someone. Not that you want to go out of your way to alienate someone, but that you might raise like some ire or get them engaged, without rage baiting, but at the same time questioning, prodding, you push conversations forward, and that makes all the difference, right? That's what's part of the whole thought leadership banner is about.
Yeah. I was just thinking about in terms of his audience, and will people continue to tune in and say, well, this isn't about my industry. And
Mhm.
I don't know how to say her. Is it Emma Guild? She's like a British entrepreneur. Do you know who I'm talking about?
Mm.
She's in like fashion. Anyway, there was a famous entrepreneur who made a comment within the past couple weeks, and so talk about getting like the ire of different people, right? There were many people who were like, her comments don't reflect us at all. But if in what you're saying, Cersei, in that vein, right? Like people would still be tuning into Abiola, even if they're like, but this isn't my industry. So I'm just curious. I don't know what the answer will be. I don't know but I definitely know, like in general, Abiola, I think you will attract a lot of people because I think many people, regardless of industry, are not happy. Um,
Mhm.
Yeah. Even if I'm talking about health and I'm just looking at it from another point of view, a
mhm,
construction worker may see it and say, "Oh, this also happened with you guys. I think I need to listen."
mhm,
So that can also be an opportunity to get them. It's just to know, you get people's attention in the first 2 minutes. You get to have conversation with them. If we are able to get their attention, say something that can make them stay glued to the screen within the first 2 to 5 minutes. So we'll just be strategic to ensure that everybody is involved. Even later on in the conversation, we may have to streamline, but at least when we open the show and start, let us make it let us make it such that everybody wants to listen, no matter who you are. We get their attention. Maybe later on, they may then say, "Oh, I'm not sure it's for me," but at least we've taken like 10 minutes of their
mhm,
time and we've sown some seeds of, information into their mind. Just saying.
mhm. Very interesting. I also had this moment where I'm like, you're already embodying like everything about the podcast, right? Like you've got the headset, you are ready to go. That's awesome. All right. Love to hear from some other people as well. I know I asked a lot of questions, but it's only because I'm curious, not because I'm pushing back. Yeah. Yes.
I want to share, would love some feedback. Okay, and I just hope I understood these categories. So my podcast is for health policymakers specifically, public health professionals, people with diabetes, or people supporting people who have diabetes, and clinicians and trainees because they should also be aware of this topic of how the system affects individuals. And I think at the clinician and trainee level, we're sort of trained to always try to find out what can the patient do differently, what can the patient do better, or what can I give the patient to blah blah blah. But I think we forget that on the back end. Remember, I talked about those 15 things that led to XYZ. I think we need to turn around, like Abiola was saying, turn around the other way and look at what the system is actually doing to cause this. So that's my four. I guess, who am I? I'm a subject matter expert on treating and supporting people with diabetes and other chronic conditions. And I want to use that perspective to tell the compelling stories with the data that already exist. I'm not a researcher. I will be honest about that, but sort of blending that with what I'm seeing in real life. So as to influence those people in power, the policymakers, to change the current system. They can create policies that support disease prevention versus the reactiveness that we're dealing with, and remove access to the existing therapies, medicines, technology, CGMs, etc. And I also want to engage with people with diabetes and clinicians specifically because I want them to advocate for the same thing. So the louder we can be about this topic, I think the more change that we can, that I can influence. And so specifically, I wrote, I want other people to be so outraged about this that they also want to do something about it. So I think if patients were to understand the reasons why certain things happened, they would be really outraged. They already are, by the way. It's just I don't know. I think that we don't have a lot of action around that. My podcast is Healthcare Advocacy and Equity, Policy Change, and I would also kind of lump it under educational in healthcare. The podcast bridges healthcare system flaws with the statistics that exist and then the real life scenarios that we're actually seeing because it's all connected, but I don't think that we're talking enough about how and how literally how it impacts the actual people who have to access it. Unlike most podcasts right now that focus on the treatment of diabetes, optimization, technology implementation, provider CEs, and how do you become better at, XYZ. I think again, turning the lens around a little bit and focusing on, I think there's already so much that exists for us to become better diabetes specialists and better clinicians in the aspect of managing the condition, but not enough to advocate on, I guess, a larger scale and pinpoint the systems issues that are causing this. And then last but not least, my podcast will shift the conversation from what can the patient do differently to better care for their conditions to what can the system do differently. How does the system have to be? Like how do we model a system that doesn't sort of set people up for failure in a sense. I hate to be so critical, but that's the whole point of this, obviously. So I want to expose the current complex and reactive healthcare system by juxtaposing that with real life stories, but also bringing in people who are actual advocates who have been in this work for many years, decades, dare I say, that may have some ideas around solutions. So that's where I'm at with this, and any feedback is welcome.
Wow, very, very powerful.
you.
I'm very excited. I mean, all I can think about, so I've never specialized in diabetes care, but I'll say it doesn't matter what kind of clinician you are, you will encounter diabetic care no matter what, right? But I would dare say, and Dahlia, correct me if you think differently. I think their clinicians are taught that there are some people who take care of that and there are those that don't. And I'll say that for those of us who aren't, say, primary care physicians, a lot of times it's just kind of like, what do I need to know about the insulin regimen? And that's kind of it, right? Like, and anything else is too painful. But I think you raise such incredible points, right? Everybody needs to care, and what can they do absolutely about it? So I see it, one outraging patients, then outraging clinicians and being like, wait, I need to do better. And I don't need to just, know the bare minimum about diabetic care or say that's not my job. And then, yeah, everything that you were saying about, because I think a lot of what I hear too is about all these wonderful new technologies, which I'm a huge med tech enthusiast. But at the same time, like that doesn't mean that all of these systemic problems go away.
Right. The systemic problems unfortunately make it extremely difficult for people to access those amazing technologies. And there's so much money that goes into the research that brings out the therapies, the medications and the technologies that we're seeing now. And I don't know, I think there's more than enough money to go around to fix or overhaul the healthcare system. I just don't think that it's happening. And that's where I want there to be outrage so that we can push more, push that boundary a little bit more to say, hey, this needs to change. We're all being affected in some kind of way.
I just had this moment. So Cersei knows, she's been with me before, right? So the amount of money that goes with pitch competitions, but for most pitch competitions are about what new technology do you have? And then we're going to throw, hundreds of thousands, if not millions of dollars at you. But we don't have the same, like, identify the systemic issue or issues, and then we're going to give you money to solve it. That does not exist in our
I
world.
would
We
love
basically
that.
it's basically an academic thing. It's like, oh, like figure this out, and like, oh, you get a prize and you're so smart. But other than that, we do nothing about it. But
That's an
You know,
interesting idea.
and just Paola, like what your podcast speaks to, I run like the research division at a nonprofit called Health HIV, and we talk about these issues every day. So you're certainly you're like touching right on um, what other folks are talking about and having challenges talking about, because for so long the onus has been placed on patients, like what you need to do, this whole lifestyle thing. And it's like, no, what can the system do? Spin it around. What is wrong? Why is it so hard to make an appointment to do this and that and the other? So you're right on the pulse point of what's happening.
Good to know.
Yeah.
Thank you.
So there's lots of opportunities to push that out. Yes.
anyone else want to have a commentary for Dr. P or Abiola? No? I am mindful of time. It's very easy for us to get very deep into these, but I want to make sure we give time to everyone. So anyone else like to share?
I can share mine. Josephina, I see that your microphone is unmuted, so please, if you want to go first, please let me know.
Oh, please.
But basically, okay, so I wanted my podcast to be for the general population, for the healthcare provider pipeline, for policymakers, and I think that's probably good. And then for who, I am someone who's a part of the trainee pipeline, and someone who is a part of multiple minority communities that are being, impacted right now by the different policy changes that are happening with like Grad Plus loan caps, basically the dismantleization of all these protective things that we've had from like the civil rights movement. And then my podcast would be more data-driven storytelling. I'm trying to remember the other podcast categories. Also, partially opinion-driven, just because it's me and I always have an opinion on everything. And then the key benefit or what it solves is my main argument for everything is essentially, as a provider, we are taught this is how you should treat patients, but then that same grace is not given to the providers. Like we have so much research that shows sleep deprivation is almost in line with, being under the influence of a substance, and yet we still have 80-hour work weeks for our residents, or we still have providers that have back-to-back 24-hour shifts, which makes no sense. And also just looking at someone like we are taught in medical education, this is how you treat someone that is a part or identifies as having a disability. But yet, if you yourself have a disability, if it's not considered, disabled enough, then you're either not given that same grace or you're told, well, maybe you're not even competent enough to be here, which is crazy. And then it would be unlike, I think the for-profit systems or people that are out there in the podcast world, or like people who really focus, like we've kind of already stated, but like really focus on patient care rather than how physician care can also impact patient care and really looking at those interconnections. And then the differentiation for my podcast, I think, would just be talking about how it is very important that we support diversity within our medical systems and pipelines to then trickle down and have a better healthcare outcome in terms of like, you're going to hopefully see increased empathy. We're going to see better lifestyles, maybe more people wanting to go to medicine instead of people not wanting to do it because the barrier to get in is so high and steep, especially if you come from a low SES background. So yeah, it wasn't as beautiful because I don't have it in front of me. I'm just going off the top of my head, but hopefully that was okay. And any feedback is always appreciated.
Yeah, absolutely. Like once again, things that I always have a personal bias, to many things that you said. And I feel like not enough people are saying it. I feel like you have to shout it at the rooftops, like the need for physician and or clinician care and how it completely is opposite of patient care. Because you're right. It's like, and to a certain extent, it's as if I'm looking for like the less harsh term to say. Um,
Like
but
physicians aren't human or
well,
we're
no, but no,
superior.
we are held to a different standard than everyone else. It's like you say one thing to the patient about disabilities or about their illnesses, but then yes, as a physician, it's like no, you cannot nap, you cannot rest, you cannot care about like the level of selflessness that is required is pretty insane, even for people who naturally have higher empathy and selflessness than the average person. It is. Yeah, it's pretty bad. But so I love the concept. I think there's so many directions that you can definitely go in, Dahlia, as well. And so I think you can, be successful too, and just kind of in general, like talking about medical student, resident, physician care, and then obviously how everything impacts, right, from like the policies of and I'll just tell you, 80-hour work weeks, that doesn't exist, hun. Like people are working far more than 80 hours. Everyone's lying that they're working 80 hours. Everyone's working much more than that. Um, but anyway, I think you can have like a broad kind of focus, and I think you don't have to like narrow down specifically into just disabilities or like, like the different policies that the Trump administration has done, et cetera. But other comments, I could go on and on. And also, that what might make it interesting as well, Dahlia, is like, let's be real. It's that a lot of the times, people are saying something similar to what you've said, and everyone's kind of nodding along and saying, yes, of course. But the powers that be behind closed doors are saying no, and they're not changing the amount of hours that people have to work or how it's gotten even harder to get into medical school. Like, I've told this to Circe, like 20 years ago when I applied. It was hard then, it's gotten worse. And they continue to add more things. And it like talk about like some structural, you know, um, you know, uh, incredible structural barriers on purpose. Like it is my belief that certain populations are being kept out because certain things um are kept in. So I don't know if you're ever interested, but one of the things that I'm somewhat iconoclastic about is even the prerequisites for medicine. So one of, you may have heard of some of the research where people have talked about getting rid of organic chemistry and physics as a prerequisite. Because at the end of the day, what physicians end up using for that is like almost nothing. The average physician does not use it. It's used as a prerequisite, mostly as a gatekeeper. Same thing with the MCAT. Not to say that, we should not have any standards, but many of the standards that exist are gatekeeping. They're not necessarily to give you, they're not necessarily preparing you to be a physician as much as they're keeping people out.
Or like the step board exams. Yeah.
Or at least in terms of how they're, I mean, so I think I don't know if everybody knows about the step exams, but these exams are like 9, 10 hours. They're insane. The average person's head would explode. And have you taken your step one yet?
I just took step one. I still am waiting for my score because there was some time irregularity, so it's extra delayed. But yeah, it was a beast of an exam, and I felt like I knew the content. The trouble with like studying for it was a lot of like, how do you test, not do you know the content, which was very frustrating for me, especially being first in medicine, first to graduate college. So I'm like, oh my gosh.
Yeah, and step two and step three, it keeps on going. Like, but it's, and once again, not being anti-rigor, because I think the argument people make is, well, you're being anti-rigor. Not necessarily the case. It's like, knowing the material is different. If you decide, that in order for a person to succeed, say on a 9-hour test, one, you have to have a certain level of executive functioning that you can sustain for 9 hours. That's one, if you do it that way. The other thing is like, can you answer these questions within less than 2 minutes? You may know the answer, but you're not as good if you can answer it in 5 versus if you can answer it in a minute. And so all of those things, huge structural barriers, no one ever talks about, right? But those are decisions, very intentional decisions. Anyway, I'll stop. So, Josephina.
I'm always so astounded when I hear from my friends or colleagues who are in medicine just about all different aspects of the system, like how the residency, it sounds like the structure hasn't changed for so long, and the hours, and for like the profession that's kind of the embodiment of like healing and health, it seems like pretty backwards.
Yeah.
Yeah, so I can share a little bit about my podcast, just from some kind of notes I jotted down. It's not like it's written out, but my podcast is for people who are interested in mental health equity, including public health practitioners and community-based organizations, and then hopefully policymakers as well, and community members um, who are looking for more community-driven and holistic models of mental health care that can address gaps in our traditional healthcare system, especially for people and communities that are most impacted by structural racism and structural inequities. Um, and in places even like Boston, where I'm located, there are waiting lists at some of the top hospitals that are several months, or just across the US. We know, for example, only 2% of psychiatrists are Black, so there's huge gaps in the traditional mental health care system. So my podcast is a public mental health podcast that will bring together, um, I'm hoping, some of the perspectives that aren't kind of usually pushed forward when we're talking about mental health, community perspectives, community lived experience, and as well as evidence to really support more community-led models of care, which is especially important with all the cuts in kind of behavioral health funding, community health funding. And this will hopefully reshape how we think about who delivers mental health care support, as well as what counts as impactful, and complements other mental health podcasts that I think usually focus more on clinical care or individual behavior change or specialist perspectives, and focus on historically underrepresented voices and models of care. And I think, yeah, I hope to bring my own experiences with direct service as a community health worker, as well as my experiences with research and evaluation and public health program implementation, and overall really focus on community mental health from a strengths-based perspective, and looking at models that are community-led, models that are already working for people, and focus on how communities themselves are defining mental health and wellness.
Yeah, so lots of different directions you can go. When you're talking, Josephina, like one of the things I imagine, I could be wrong, of like what you're thinking of, like, say if you had 3 podcasts, one could be on this is one different community model. And I don't know what those necessarily are, but that's what I was thinking of. Like this episode, this is community model 1, 2, 3. These are the stats of how well they're doing, especially as you said, right? Because it's months before that people can see a psychiatrist.
Yeah, yes, definitely. I think there are definitely programs that are so amazing that I would love to interview the people who designed them, or led them, or leading them now. Um, yeah, really amazing work that's happening that I'm really excited to kind of delve into. And I think especially because, um, for some of these programs, like, and I've experienced this myself, when you're running a program and like doing the actual work, there's barely enough time to kind of um, do like the evaluation and fill out, the report you need to for your sponsor, the grants. much less to write up something that, is published in academia or other forms of communication. So I think it'll be really nice to try to highlight the amazing work that's happening.
Awesome. Yeah, Dr. P, I think you had a question.
Thank you. More of a comment of how one of your old cohorts, I can't remember if this was maybe last year's, when you were speaking, Josephina, I sort of thought of Kasha's podcast, last name Spellman Timmons. I had written some notes a while back before all of this. She called hers deliberation sessions, but hers specifically did focus on mental health and how healing and social justice. And just like I only got to pop in for like 20 minutes of like her first episode. She interviewed two social workers who had been in the work for a long time. And I think I feel like either she might be someone good to connect with or just maybe look at some of the stuff that she put out. Sorry, Kashe. Thank you so much, Dr. Cersei. Someone that sounded like she had a lot of experience in this topic and a lot of passion around it. So it might be helpful to either connect or to look at some of her stuff and how it relates to what your topic is too with behavioral health in the community.
Yes, definitely. Thank you so much for highlighting that. I think if it's the project I was thinking of, there was maybe something else about like some intergenerational piece that I think is also really interesting. So yeah, thank you for flagging that. I'm definitely gonna look at her page again.
Yeah, you guys will have the opportunity tomorrow to meet a few of people who've done podcasts in the past. And so, yeah, you can ask them directly. And then obviously anyone that you've seen in the BCPH network, if you're like, hey, who's this person? We will do our best to get you connected to that person as well. So as many resources as we can, right? So if you want to email like a previous BCPH podcaster, by all means, or tap their network, then that will be helpful. So thank you guys for that reflection. Hopefully, I feel like you guys are getting like really knee deep and excited. And I will say that it does feel very different, this thought fellowship, than previous ones, because at different times in the fellowship, sometimes some fellows are still trying to figure out exactly what they want to do. You guys definitely like know, like you're ready to go. Like even the way Dr. Cersei was talking, it was like you guys already have like your episodes and she's been watching them and I haven't seen them yet. So yeah, I'm very excited. So yeah, want to continue to build that momentum. But I will go ahead and jump back into the slides. All right. So obviously you guys like had a chance to share a lot of the great things that you're wanting to do in mental health, diabetes and chronic care, obviously like human-centered occupational health, and obviously like any kind of, physician, resident, medical student, I would say justice overall, right? And disability justice as well. All right, so podcast planning, not to be taken lightly. I think there was a question last week about this as well. So planning, sometimes even beyond the actual podcast, planning the podcast and then even reflecting and refining after the actual podcast is done can be some of the most important parts. So just wanted to go over some best practices in terms of how you plan each of your podcasts and then how you actually take advantage of that post-podcast period. All right. So obviously we talked about like each podcast, each one should be different, right? So right now we're still at a fairly high level of in general, what is my entire podcast about? But each episode, definitely think about if there are, say, 3 different goals that I have for each podcast, what would it be? And sometimes we've seen fellows actually collaborate with their guest or guest to be like, what are the goals that you have? And they may do a pre-interview before. And so when they go into the actual filmed podcast, they already know exactly what's going to happen. Or sometimes people like to do it off the cuff. But either way, having those goals ahead of time, make sure that you have an even more impactful podcast as well, right? And then we've talked a little bit about audience, but also being mindful that each individual episode may actually have a slightly different audience, right? It might garner a larger audience, or sometimes it may just happen to be more niche. So always be mindful of that as well in terms of like how you're framing some of the questions that you're asking the person, how you're actually going into any additional research, etc. Because as I said, right, that can really change, who's tuning in versus who's dropping out, right? And what themes are you linking within your podcast? Because they can be multiple themes. It doesn't just have to be one. So obviously, like selecting your guests, I hope all of you are doing this right now. If you haven't already reached out to certain people that you wanted to have for your podcast, and choosing people that you feel have diverse and credible experience, not just subject matter experts, as we talked about, right? But people also with lived experience or people in between. And definitely don't feel that you always have to have an echo chamber of people who always agree with you, right? You can have people who may disagree with you because you're interested in having a conversation, respectful, of course, but nonetheless, it might be very fruitful to have a conversation with someone who disagrees. And so, as an example, so thinking of Dahlia, right? Say, for instance, you had an episode on the number of work hours, that medical students have or residents have. You can invite someone who firmly believes in the 80 work week or actually, is willing to go on air and say, no, I think physicians, should be working 100 hours or more. And I've actually talked to some of those individuals themselves, and usually their reason is because you want to see the entirety of a patient's disease progress. And if we have too many handoffs, that actually is detrimental to patient care. So it might be interesting, right, having those conversations so you can delve into the rationale of an opposing opinion, and then sometimes kind of go toe to toe with, well, that actually may not be the case, and you can delve into research that might topple that contrary opinion. So when you're sending your invite, I believe it will have some different templates for you as well, making sure that it's not just generic, right? So being able to speak to that guest, acknowledging exactly what their expertise is, if it's research, if it's data-based, if it's lived experience, or it's a mixture of those things, and making them feel special. Dr. Search and I have found that the more you roll the red carpet out, you show people that you value them and you think that they're unique, the more likely they're to say yes to your request, right? And then making you're doing any kind of preparation. So if you're inviting somebody on and they're, a recent author, maybe you want to actually read their entire book, or if they just published a white paper, or, if they've had a similar podcast that's, has many topics that you're going to be talking about, then you may want to watch all of those things, right? And so some podcasters will spend multiple hours. They may spend 5+ hours or more just doing the preparation to make sure that they can have the best podcast episode ever. And so be very mindful of that as well. I know that all of you are very busy individuals, but very rich podcasts definitely, go hand in hand with the preparation you do of the research you do beforehand. And then obviously confirm your tech. So Abiola already has everything ready to go, right? Already testing the mic, and the actual microphone, but making sure that all of that is set up for what you plan on doing well before the recording, and definitely give yourself probably anywhere from 30 to 40 minutes before you go on air to refresh yourself, get comfortable, but then also making sure that your guest has time to get there, especially if you're going live. There's nothing worse than if you go live and there's a number of things that are fumbling, the person gets there late, there are tech issues that you have to be able to troubleshoot. So making sure that you build in plenty of buffer time. So the biggest thing that I say is that don't expect ideal situations. Expect something to go wrong and build in enough time for, like, okay, here's 5 minutes there, 10 minutes there. I don't know if there was a hand up, but if you could shout out if there was.
Yes, it's me. Paola, I have a quick question, or two questions. The first one is, if we're having scheduling issues with our guest, is it possible that our first live one could be sort of a hybrid where, let's say I couldn't get my guest to come live on that day, but we pre-recorded something. And so I can introduce the episode and maybe do a spiel and talk maybe a little bit about myself and this, and then say, and now I think this conversation with so and so blends very well with this topic, so we're going to transition to that now. Something along those lines. Would that be appropriate or acceptable, I should say?
So I'd say, so we're planning for your first, for all of you to do the audition, that there will be designated days where the BCPH audience in general will be invited. So in that particular case, we definitely want everything happening
Okay.
as scheduled. that in terms of your regular things, podcasters have different things, right? Some people live very busy lives and they're podcasting on the side. So if it works for you where certain things are pre-recorded and other things are spliced together, but like
Mhm.
obviously they've happened in different times by all means. So whatever works for you. And I definitely know many podcasters do that, right? I know one of my favorite podcasters, Ed Milet, he'll often splice together four different interviews that obviously have happened at different times.
Okay. And then the second question was, oh, yes. So I know the aim is to have at minimum 3 podcasts. I wanted to clarify, are all 3 of those live? And is there a particular, I don't want to use the word recommendation, but a particular requirement that each one should have a guest that we interview?
No, so there's the audition, and then the three. So all of you have the chance to audition, right? So all of you get to complete the curriculum and audition. And then from there, we decide who we will invite. And the biggest things that we decide on are those people who essentially have showed up and showed like they're very committed. And just this is only for the sake of making sure we allocate resources appropriately. It's usually been a better decision if people have missed multiple times, not caught up, or they don't seem as deeply engaged, and or when they did their audition, they just were ill prepared. Then those individuals are those that we do not invite to do the additional three. So I'll say that first. And then in terms of the three, if you want to do a monologue, we don't tell you you can't do that. If you want to have it to be a guest where it's like you and one other person or you and a whole panel, that is entirely up to you. We try to give you that freedom in terms of like the structure of everything, if that answers it.
Yes, and then one more question. Can you describe to us the audition? So I didn't realize that we were auditioning for something. Can you elaborate a little bit more on that? And is
Yeah.
that when we read the handbook, is that what the dry run is? Is that the same thing as the audition?
So the dry run is when you meet with myself, Sabath, and Dr. Cersei. So you basically get to prepare all of that, right? So you walk through exactly what you're going to do. Some people show up to this more prepared than others, and they actually want to kind of, we can, myself, Cersei, Sabath, we can pretend as if you're your actual guests and go through it that way. And some people just say, I'm going to do this, this, this. It's only so that people are more flawless. Some people, like I said, they just blow through it. It's super easy to do. Other people, they actually very much need that dry run because there's certain things that they may not have thought out that as the steering committee, we're able to point those things out to them. So the dry run is separate. It's like a practice with the steering committee. The audition is essentially what looks like a webinar. We invite the BCPH audience, and so you'll have a number of people come, and then we make it so that they can evaluate all of you in terms of how dynamic you are, how interesting your particular podcast is, and any other kind of feedback. And then we give you a lot of feedback, regardless of if we invite you to do the additional three or not, because ultimately putting together a podcast, it's not just being experts, right? It's also being able to and having the thought leadership, but it's also making sure that people are willing to listen to you as well. So we want you to be successful. So obviously, like we try to make lots of activities so that we get to know you well enough so that when we are giving that full-fledged, robust feedback, hopefully that you feel confident and comfortable enough to trust that as well. Because many times we've seen that there are plenty of, BCPH attracts very smart people with great degrees, etc. But sometimes not everyone may have the most dynamic personality. And so we try to encourage people as much as possible to say, you know what, you've got a great topic, you've got great thought leadership, but you might be, your audience may be tuning out because the way that you present it is not necessarily catching on.
Thank you. I appreciate that. That I have a little bit more clarity as to what is to come. Thank you.
Yes, absolutely. And, I know that it's just been kind of outlined in the handbook, hence why we definitely want you guys to go through that, but happy to answer questions as it comes along. And like I said, I cannot see the chat at all right now. So any other questions, please jump in because I am completely blind except to my presentation. Okay. All right. We will continue.
No, that was great. Thank you.
All right. So stepping back, right? Like that bird's eye view. Some people have a script and an outline. Some people just kind of go off the cuff. We would recommend having a script to some extent. It doesn't mean that you can't be improvisational. as you go. And I think that's what makes podcasting fun, because you just never know what you might say or what insights that you might have at the time. But it can, I think, be very comfortable, especially if you show your guest, these are the questions that I'm going to ask you and some of the things that I may follow up with, especially because, and one of the things I myself have, with interviewing hundreds of people at this point, not officially for a formal podcast, but through lots of different things, that have been podcasty. I've met more people than I can count who they're like, yes, I'll be a guest on this podcast. And if it's not live, many people will come back and say, please edit this out. And so usually that's because a person wasn't expecting certain things. So the more people can expect, the less editing you're going to have to do. Because I'll say personally, there's nothing more frustrating than you wanting like the raw um, expose, and then the person that you actually interviewed says, I actually feel incredibly uncomfortable. I don't want anybody to hear that. So the more you can kind of let people know up front, the better, the less editing you have to do later. The other thing is if you happen to always go live, right? So not wanting to make people uncomfortable and potentially having anything awkward happen if they don't know what exactly is going to be covered, and knowing what people's certain spots are. So this may not be something that people think about, but just because someone says that they agree to come on your podcast as a guest doesn't mean that they're comfortable discussing anything and everything, even if that they've written about it extensively. That's one thing that surprised me myself, things that people have written in all different ways, all over the internet, but when it came down to a podcast, they did not want to go into it live in front of an audience. So being very mindful of your guest and what those surprising landmines might be, because more people have them than not. And then also like getting a sense of, does your guest want to be introduced? Do they want to introduce themselves? These are very simple things, but some people can be very sensitive about that. Some people really want to introduce themselves, or they only want to be introduced a certain kind of way. So have a flow to how that might be. Does someone want to be introduced a certain kind of way, etc. Ultimately, obviously making sure that your guests, they may want to have key talking points. Some guests want to be led through it. They're like, pretty much tell me what to say. And there's some that are like, nope, I'm the expert. I'm going to go with it. So making sure you understand, you may have guests that may have very different needs when it comes to talking points during your particular podcast. And then ultimately, right, thinking about how much time am I going to have, if any, for an audience. If it's live, how much will come through? What am I comfortable answering? Um, is there anything I might not be comfortable answering or having my guest answer? Those are always things that Cersei and I are dealing with as well, because that is very real. And then ultimately thinking about, what is your call to action for each podcast? As thought leaders, I think it's even more crucial, right, to think about that ahead of time. But then as you've had that conversation with your guest or your guests, there might be even more calls to actions that you think of and you synthesize as you go through your podcast. All
Are
right.
we, I'm so sorry for the, oh my gosh, audition. I'm so sorry, I'm blanking out. I know we're going to potentially introduce our guest or have them introduce themselves. Would that be a good time for us to introduce ourselves and our background, or are we expected to do that in the 2-minute video? I know we are going to talk about our background and the purpose of our podcast in that 2 to 3 minute short video. But in terms of the intro during the podcast, is it okay to go into more detail as to what we do, or do we just short, like brief, and then focus on the guest that we have and kind of jump right in?
Sure. So the intro video is separate from what you're doing with the audition. So a lot of things that we've done, just like the exercises I've had you guys do so far, are just to really get you in that mindset of like believing you are a podcaster already. So that video is separate. Yes. So during your audition, by all means, introduce yourself, not for 30 minutes. We definitely had a fellow do that before. Don't do that. But this is, yeah, you're auditioning to the world, right? So I believe all of you are completely new to podcasting. I don't think anybody else has had a previous ongoing podcast. So yes, you'll be introducing yourself to the world, right, with your podcast. And so to what extent how you want to introduce yourself and introduce your podcast, you can do that at that time in the audition.
Thank you.
All right. So during the podcast, right? Welcoming warmly can be great, can definitely set the tone as well. I know with some podcasts, some fellows like to just be chatty. And you might, obviously, as you've listened to different podcasts, sometimes there's a more kind of like, shooting the shit, as they say, before you actually get into it, or you might just jump into it. So obviously think about like how conversational you want to be, listening very actively in terms of the follow-up questions that you have, but at the same time, being mindful of the fact that your guest may not want to answer those things. And especially for Abiola or anyone else who has that challenger or contrarian mindset, being aware that there may be times where your guest is trying to dodge a question and you have to decide, do I want to continue to challenge them? Or do I not? Do I want to drop this particular one or come at it with a different angle? All of that is very critical in one, preserving relationships, but then also how like the podcast is perceived. And I think there's nothing more that can be said that when a podcast can get overly heated, and while that may, draw more attention, that may not necessarily be what you want. So just kind of thinking about all of that ahead of time. And then managing your time. So obviously podcasts, many of them are fairly short. We do give you about an hour's window to be able to do the audition, but you may decide ultimately when you're doing your podcast, you may actually interview somebody, say, for 2 hours in reality, right? And then trim it down to 25. It's up to you, right? Lots of people do different things, and you're just like, I'll interview for 2 hours. I splice it down to 25 minutes of like the very best. That ultimately is up to you. Um, and I'll just say in terms of like, energy and engagement during the podcast, right? So all of you probably have your favorite podcasters, and it's not just people that are droning on and on, right? It's not the smartest person, necessarily who's a podcaster, right? It's a person who is a natural storyteller, the person who's very engaging with their guests, right? But then also the audience feels like they're learning something and they're actually taking something important back with them into their lives, right? And then the other things as well, and this is what we go over in the dry run, as well as there are different tricks to things you can do in a podcast in terms of summarizing certain things that have been said after they've actually been said, right? Reinforcing key takeaways from your actual guest or guests. And we'll go over that in the dry run, and I can send additional things about that. So post podcast, right? So as I mentioned before, just as important as planning ahead of time, if you decide to where you're going to trim, right? Always check in with your guests. You don't want angry guests and you don't want to get sued, for including something in a podcast where someone says, no, I didn't want that. So making sure you take care of that because nothing can be, more anxiety provoking or a headache if you don't know exactly where to trim that particular podcast. Intros and outros, Dr. Cersei will show some of the different tools that we have, like Envato Elements, of what kind of music do you want before and after, right? I think that can be a huge thing, right? If you choose something as more lively and engaging versus more somber versus more comedic, all of that can set the tone significantly for your podcast. And believe it or not, whether or not people actually continue to engage with it. So think carefully about your intro and outro and then your consistent branding as well. So even with the music that you may play at the beginning and end of your podcast, there may be certain phrases or things that you say, right? And you can think of any of your favorite podcasters that have certain things, right? That can be like that trademark for your podcast. And then post podcast, so promoting. Ultimately, like you guys will all have the chance to use the BCPH Substack to post your podcast. So it's much simpler than it has been in previous years to be able to do that. But in the future, you may decide to put it in other places. So most places like Apple, Spotify, you usually have to have about 10 podcasts before you can go official on those platforms. So just being mindful of that as well. And then also things that you might do in terms of promoting it with different social media clips, tagging, different transcripts and SEO. So we didn't go into all of that, but if you've actually studied any of your favorite podcasts, they usually have, like that blurb about what the actual podcast is about, the actual transcript, and then some other things that make it very discoverable as well. And if you want to essentially go viral and really increase your audience as well as how much of a leader you are, the post podcast is what can matter the most, right? Because you can be amazing in the podcast itself, but if nobody knows about you and your marketing is non-existent to fairly minimal, then you won't get discovered, right? So having some of these best practices are very important to continue to hopefully fulfill all of your dreams, right? So people are really listening to you as that thought leader in your given public health areas. And so ultimately, BCPH, we obviously try to do as much feedback as possible as we've been trying to demonstrate even during today's session, but then make sure you're analyzing your performance, right? And thinking about, what could I have followed up on? What may I have probed a certain kind of way? Would I have changed anything about that, right? You want to make sure that you're learning, especially your first few podcasts, learning as fast as possible about what may have been successful so you can keep doing that and what you can do differently to make your future podcasts even better. All right. And so this is just a reiteration of what we talked about before. And I think many of you are already absorbing that, right? Thinking about your content strategy for how you're going to design your podcast, but then also how you're going to select your particular guests as well. So I'm mindful of time here. So on the same, oops, let's see, escape here. On the same link, and I'll put in the chat, I made some changes. So hopefully if you refresh and or you go back to this, hopefully it works now so that you're not getting the same issue.
For me, it shows up mine, like whatever I had already saved and downloaded, which is, I think that's a good sign.
Okay. I think as I pulled mine up, I think I may be seeing yours actually.
I am too.
Yes. Okay. Hmm. So obviously we don't have a chance to do this now, but I'll send you a multiple ways to fill this out. But what I want you guys to think deeply about, oops, you guys can see my screen. Yes, is more so about, and we've already talked about to some extent, right? What is your audience, your mission, but things that we haven't talked as much about, right? Who are the people that you're going to partner with, the institutions? You can do that already with BCPH. Not only can they help to feed the number of people into your podcast, but they can also help you in terms of marketing as well. So the more you think about that, the better off you'll be as a podcaster. So definitely try not to do this in isolation, right? So you have the benefit of being a fellow with BCPH, so you are not alone in this, right? You have the steering committee, you have your other fellows, but then also continue to add on people, right? Because the most successful things obviously have very strong partnerships. So think about who those are, and obviously you can approach them and say, "I'm a BCPH Thought Leadership Fellow. I'd love to partner with you on this. Would you be interested in also playing my podcast on your channel, et cetera, et cetera, inviting people to my podcast?" And then thinking about your competitor analysis. So we've done that a little bit, right? But who are the other people talking about what you're talking about, how you truly differentiate yourself, right? And so I think most of you already done a great job of this already. And then thinking about resources, Dr. Cersei will talk about this as well, but what are the things that you're going to use? I think some people can be on one side of the spectrum where like they use so many different tools that they get overwhelmed. And I would definitely recommend that less is more. Decide on what exact platforms you're going to use in order to make your actual podcast and what are the things you're going to use in terms of preparing it. And don't feel like you have to have 10 different things to be able to make a successful podcast, but things that that will work for you every single time, right? So if you say, I know I'm going to take this amount of time every week on a Sunday to prepare my podcast, and that I know I'm going to tend to shoot my podcast on a Thursday or Friday, et cetera, right? So what is that whole planning process? The more of the rhythm you have, the more likely you're going to be successful and do it, as opposed to you're like, I'll get it done when I get it done. You can, be successful for the fellowship, but in terms of it lasting long term, it's harder to sustain than if you have that regular rhythm. And then also content repurposing. I think it's big. So right now you're thinking, I'm just doing a podcast. But if you're interested about being a thought leader in all different ways, you can make your podcast and then turn it into potentially a research paper or turn it into a white paper, or you might be invited to give a TED talk or another type of talk as well. So thinking about how else can I extend my thought leadership beyond a given podcast, because that's one of the things that you'll find, right? The podcast is one medium that you can be able to share some of your insights, but there are other ways that you can do that as well. And obviously, the more platforms you have for thought leadership, the bigger that you will grow ultimately. All right. I'd love to hear any reflections, thoughts.
All right, just want to say something. Can you hear me?
Yes.
Oh, okay. Yes, I like a part where you mentioned the guests. And one of the things we learn too in journalism is to ensure that you protect the reputation of your guest. Don't make them look like the bad guy and you are the good guy. You have to do as much as possible, even if they are saying the wrong things. You have to find a way to you are the one in charge. So you have to find a way to still protect their reputation and make them look good to the audience. So you're not competing with them. So we are not looking for who is good or who is bad. So that resonated with me. I also want to suggest, if possible, in when we want to have for every show we do on radio or on TV, we have a producer. Not necessarily the guy behind the camera. He's just somebody who tells the camera person what to do, tells the audio person, okay, tells the person, okay, we are going on break in the next 1 minute. They just ensure that you follow whatever script you have created. So I want to suggest, if we can find a way to share give us responsibilities to produce other fellows. For example, I can produce Dr. Paula's podcast, while Josephine can produce mine. We just do that if it's possible, to ensure that we also have each other's back. Just suggesting.
Yeah, no, you are welcome to do that. Something that we've honestly have not thought of before. Like I said, because each cohort is different and we've had different opportunities and challenges, I will say, right, in terms of people's ability to how much they can give to this and how much they're willing to invest. So I will say that we won't make it a requirement, but yes, if you want to be producers of another fellow show, or if you want to have another one, definitely by all means, we will not will not restrict that. That's one of the things we know is a limitation of the fellowship, is that it's a good thing and a bad thing. It's a good thing in that, like, you learn every aspect of it, right? Even if when you go on to become full-fledged podcasters, you may have the producer, and some people have the writers, and they just come on and like they're just the talking head. And ultimately, like with this, you learn all of the different aspects, and then you learn the stuff you love and the stuff you hate. So I hope you see it from that vein, as opposed to BCPH didn't do XYZ for me. No, BCPH taught you the whole process and then allowed you to understand, yep, I need a team, versus, you know what, I'm totally confident doing these different parts.
I like that idea a lot, Aviola. That's exciting. I was already telling my my wife, I'm like, this is gonna be hard. I need your help. I need you to be my producer. But I love the idea of having like a fellow do that for us, because we're undergoing the training and learning from the experts in this.
Mhm. Yeah, that's wonderful. Speaking of like who's our producer, I feel like so Cersei actually came out to California a few weeks ago and was my producer for something that I was doing. So yes, I have my my diehard too. So yes, it's always good if you have someone who's helping you with things. Thank you.
We have each other's back.
When I clicked on the link this time, I wanted to just clarify the Thought Leaders Canvas, that part. I do
Yeah.
see something that's already pre-filled. Can we go in and change what's there, or is that meant to be there? I'm sorry, those pre-filled sections?
I don't
No,
think
No?
so.
Okay.
so like I said, I'm gonna make another adjustment because I made it in one of
Okay.
my app builders, and
Got
yeah.
it.
just have to change a couple glitches, but I might make it to where, yeah, I'll change it. And I'll send it to you so then like we can just quickly go over it next week. Thank you. Other
Right,
reflection.
Candace?
Yes.
You just wanted to confirm, like, you're through? You're good?
No, I wanted to hear from everyone.
Okay.
Yes, I was just waiting politely to see who else wanted to go.
Sorry, I
Okay. I
guess I
think
can
Dalia
also
wants to say
speak.
something.
I know for me, I'm just like excited. As you were saying all these things and like expanding it past the fellowship podcast period, I literally was like, okay, I can bring in this group and I can bring in this group. And I think I'm, in a good place where like I have to figure out who is going to be the people that get to speak because I have so many ideas all over the place. And so trying to narrow that down, but I'm very excited to get started. And it's really nice to know that we have help and it's not just like, hey, figure it out. So I'm really excited for
Mhm. Awesome. Yeah, absolutely. Yeah, we definitely want to make sure, like I said, it could be, it's for us, it's always deciding like how much should we put on you guys? How much are we capable of giving you? Given, what the organization has. And then at the same time, how much of a runway can we like hopefully catalyze for you, right? So you essentially do 4 podcasts with us. You do the audition and you do the additional 3, right? As I said, if you want to be on Apple or Spotify, they usually require 10. But we're hoping that with the first 4 that you do with us, that you gather enough momentum that you can keep going, so that it helps you move faster than you would have, say, otherwise if you were just doing it on your own.
So if you audition and you don't get invited to do 3 more episodes, does that end the fellowship at that time? And then you kind of choose to do whatever you want to do with that? Okay, thank you.
Yes. Yes.
I'm
All right.
also just echoing what Dahlia said. I just excited by the conversations we had today, even in our breakout room, and thinking about how our topics and interests and skills kind of overlap as a group. Um, and also, yeah, this is inspiring me to think more about thought leadership more broadly and kind of the message that I hope to share in different ways.
Awesome. Excellent. Well, I feel my goals have been accomplished for the lecture in terms of what I wanted you guys to take out of it. So, yes, without further ado, I will conclude. Thank you so much. Sabat, I'll let you go ahead and take over.
Yeah, I think, thanks, Candace. We've already gone through some of the things I wanted to talk about. First off is the introductory video. Um, we should we should look at section 12 of the handbook. It's just very straightforward. You would see what you need to do to put together the introductory video. There's a link there already. And you could also look at the past fellows. I know when we were scheduling the interviews, we gave you links to all the fellows. So you could go to their pages and see how they did their 1 minute to 2 minute video to just introduce their podcast. And there is a folder in each and every one of our drives that has the place where you should upload the introductory video so we can have it and also, upload it on the website by ourselves. So it's important we do that before we even begin the um, auditions and the live webinar, as we call it. Then tomorrow we'll be having a session as well, just to buttress some of the points that Candice had touched today. So we have some of our past fellows coming to discuss, the end-to-end of, content development from planning to execution to post-production as well. So we would have in Buffy, Sad, and Sade. They'll come to talk about some of these things we have questions for, and you could ask them more about, how to come up with, very, very lively and engaging podcasts. Then in terms of scheduling the dry run with us, so the dry run is basically just to walk through what you would be doing in the live webinar session. So it's just to ensure that everyone is up to speed and helping with planning as well. So just some form of accountability from our end. So between 17th and 31st of this May, you could schedule any 1 hour period with us. So you can just send me an email, then I'll confirm with the other members of the steering committee of our availability. So just want to ensure that we have that 2 to 3 weeks to ensure everyone, is up to speed. Then from June 1st, we would, begin the promotions for the webinar. So you could have 50, 60, 70, 80 persons attending and can give you feedback, which we would share with you for you to improve on yourself as well. I've talked about the live webinar from June 1st to June 16th. So all this is in a bit to, keep us in shape and ensures that everyone's eventually go over the line to produce the 3 podcasts, which I think we would. But if we do not show the commitment, probably we are not ready. But I think from the discussion so far and the preparations we're making and some of the ideas that Bella have been bringing, I think we should be up to speed. But it's important that we schedule the dry runs and ensure we do that live webinar session because you're going to get real feedback from your actual audience. You could invite your friends and the audience you want to listen to your podcast to that live webinar session where you talk about, the meat of your thought leadership. So those are just a few announcements. So we'll see you again, same time tomorrow, but it will be a shorter session. We'll not spend the whole 2 hours tomorrow.